have Charlene Peters here with us from Greystone, and she's going to talk about what's going on with the clinical aspect of all the patients and the residents in their facilities in terms of what it was like pre-COVID, through the COVID, and actually what it's like now.
I think that, things that have changed over the last 20 months for us as an organization is really understanding that all of our positions were neutral, that regardless of the position that you held within our homes, every piece of it was essential to care for the patients. And what was so intrinsic in our industry and caring for patients and being a part of their family didn't change. We just became more needed than we ever had before in helping them through those times when they couldn't have contact with their family. But being their family is intrinsic in us, and that's what we do in long-term care. That's part of what makes us different than the rest of the industry. So that piece for us just came really natural, and I think just underscored the importance of all the positions within the facility, our providers, our families. From a practice standpoint, I think that we've made history. We're all a part of that, and our industry is forever changed by that. And it's sort of one of those times that marks before and after. And I think the after effects has been something that we have preached for a very long time as far as standard infection control practices and advanced practices in infection control, and how do we manage that in our care setting, where we really run two different parallel care metrics, right? We have our custodial long-term care patients that live with us, and their goal is to live out the rest of their days with dignity. And then we have another set of patients that come to us for a short stay rehabilitation, whether that's from a therapeutic standpoint or from a medical standpoint, and their goal is to really return home. So, and we have to care for those people a little bit differently. But I think from going back to the infection control standpoint, it's something that we have, I think as a clinical industry, it's been our battle cry for many, many years, and standard infection control practices and hand washing and cough etiquette. And, we kind of are used to all the signs going up in the fall for the flu, right? And this just lasted a little bit longer. I think that what we saw over the last 20 months was the true tenacity and grit of the long-term care sector. And there was never another choice but to get through it. And our staff persevered. They still do today. Just when we think it's getting a little bit lighter and the vaccine comes and we can breathe a little bit, and then the Delta variant comes. And it's just been something that us as humans, we're not built to be in this sort of fight mode for this length of time, but yet our caregivers have been able to do that. And I think that they're amazing people to take care of the most vulnerable in this pandemic when it started, and asking them to not run away from, but to run towards these patients who needed care. And quite honestly, when it first came out, the prognosis wasn't good. So for many of them, it was coming to take care of those patients and then going home and potentially exposing their own families and even themselves. And they did it day after day after day after day. And I think that all of us have thousands of stories of just incredible feats of humanity that we all had an opportunity to be a part of. I think that's amazing.
And it goes on, and that's the thing that everybody has to realize, is that we're not finished now, so we do have to carry these on. These good habits and these good processes have to be replicated and improved upon.
Absolutely, absolutely. I think all of our associations and regulators really band together to help through this. It wasn't just in our homes, but everybody was neutral. We needed to have everybody. Very fortunate I had this one-off conversation with a vendor early in January, and the gentleman sat across from the table. We were talking about our supplies. He said, "Hey, have you heard about this funky virus that's going on in China? And I think it may affect our products in a couple months." And I said, "Well, we need to get on that now. Like, we need to order things now because we're still in the middle of flu season. I don't want to be out." So we actually got ahead of it very quickly. And my first email to the field went out on January 24th that basically said, "Hey, funky little virus in China, right? Make sure that we order extra supplies. They might be compromised." So we were very, very fortunate to have procured PPE very early in the beginning. And we activated our Greystone emergency management system, I would say by the 1st of March.
That's
so
excellent.
we were in front of it.
Well, thank you for coming. It's been so good to talk to you.